Hey guys, Dr. Ben Galyardt here, author of the book Rebuild Your Brain, Stop the Damage, Start the Repair. Super excited to talk to you guys this evening about ADD. ADD can be a life-controlling situation for many families. How do I know? Well, it happened to us. My wife and I were not able to function on that happy family structure like we knew we wanted. So I'm going to get into you guys this evening very in depth into all the different things that we went into ourselves, the whole program that we were able to create to get this process to where those little brains can function so much better. So it doesn't matter if you're a kid and this is your child that you're working with, or you're an adult and you've had these issues for years, we can help change that neurology of the brain. So that's the key thing I want you to keep in mind tonight. Not just, is there a biochemical deficiency? If that was all it was, Ritalin, Adderall, Concerta, all those drugs would fix it, move on, you wouldn't have to take it forever. But no, that's not how it happens. I'm going to show you some research this evening that shows the work that we do changes that brain and changes it with some permanency that you do not have to keep going back again and again and again and doing all of this work over and over and over. So what happened? Where did we start with this process? Well, one of my sons, I have 4 boys, one of my sons was to the point where he was getting kicked out of the classroom almost every day. He would blurt out things when the teacher turned away and like she didn't know whose voice it was, right? Well, she could definitely tell. She would kick him out. He'd have to go move rocks back and forth, back and forth. At home, same thing. He would screech at the dinner table. He was uncontrollable at different times. And we basically would pick up our plates and leave the room. It was controlling the entire family. And we were distraught. We knew after all the education, research, everything I've done, there's no way in heck that I was going to give my son Ritalin, Adderall, any of those medications. And unfortunately, I didn't have 45 minutes a night to go through the process of retraining his brain. I had gone through all this study, all these courses, but I literally could not do it, and my wife could not do it ourselves in that home environment. So what did we look at? Well, we said, we've got to come up with something that has some permanency because I don't want to be doing this the rest of our lives. It has to go through something that's going to be easy to implement. It has to be something that the kid's going to be willing to do. If it's something where you're having to do all these exercises and all these different things and they're fighting you 45 minutes a night, 30 minutes a night, an hour a night, whatever it is, or fighting you go to occupational therapy or PT or whatever it is, that's just not going to work either. So we had to go through this process, and what we found was the program that I'm going to be talking about this evening. It is a crucial part of changing the brain patterns of these kiddos permanently for where they can go and succeed. And when you start thinking about the research, it's pretty profound. The kids that have ADD, there's 5% are going to graduate from college versus it's about 21% of the regular population that graduates college. They're half as likely to have a managerial job. So they're not going to be able to, whether that's at Burger King or whether that's at Microsoft, they're half as likely to have a managerial job. But here's the kicker. They're twice as likely to go on to some type of recreational drug. Why? Because they're trying to self-medicate. They're trying to change their state over and over. And so many of you may have even gone through it yourself. When you quit drinking coffee, you start drinking Pepsi, or you start smoking, or you start drinking alcohol, and then you stop alcohol and you start smoking. And we bounce through different ways to change our brainwave patterns, to change our physiology, to try to get a different emotional state. But let me tell you, none of that is going to fix or change the brain that we're looking at now. So we went through this process. We were distraught. We said, what can we actually do? He was to the point where we were at wit's end. We were like, oh my gosh, we need to go on medication. We need to do something, but we're not going to do it. So we went through the program and we changed his life. Now he is the star of the classroom. The teacher calls on him for any issue there is, and he jumps up. I haven't had to ask him to do his homework in the last couple of years since they started giving out homework at school. He just does it. He's happy, he enjoys life, and I have all the confidence in the world he's going to be able to accomplish anything he wants. You know, that's all I want for my boys. I have no desire for them to be X, Y, or Z career or to go to X, Y, or Z school. What I want them to do is to have every opportunity, every potential to be an engineer, to go to the moon, to be a teacher, to be a trash collector, whatever they want to do, but just be happy and be the vibrant and best that they can be at those things. So That's where we started, and so then we went down the road of, okay, how can we take this to the masses? How can we bring it into our clinic, open more clinics around the country? I started in Colorado. We have multiple clinics in Colorado, have a clinic in the Dallas-Fort Worth area now in Grapevine, and we are continually working to try to bring this message to the masses. So if at any point this information is empowering to you, you want to share or like that on your Facebook page, because we want to continue getting this word out there. So just like in my book, Rebuild Your Brain, I go through some very specific things that are causing irritation to the brain, and I go through ways that we can actually help to rebuild that brain. And that's how I look at ADD as well. So what's causing damage? What's causing a lot of these issues to begin with? And then what can we do to actually build it back up and create that brain that we truly want to have, that brain that is going to put us apart from the rest, that's going to empower us, that's going to give us that ability to learn, to pay attention, to have relationships, all those things that we know that people that have ADD are not going to be able to do. So what can we do? Well, we start with the basics and we say, what is causing damage? What's causing problems? One of the big studies that I looked at a few years back, Ohio State University published this study where they looked at microbiome. If you haven't heard the word microbiome, think about this. Inside of our gut, we have an entire universe of other organisms that aren't us. So that's bacteria, yeast, virus, parasites, all these different things. And we have just as many, if not more, of those cells as we do of our own cells in our entire body. So think about that a second. We've got this whole other universe inside of us, and a lot of it's good, some of it's bad, but it usually all needs to be there. But it's when that ratio gets out of balance that we really have some issues. So what can we do? Well, when they looked at this study, they said which kids had the least amount of good bacteria, which kids had the least amount of variety of probiotics, and then which kids had the most, and they divide them into the two categories. And what they found was those that had the least amount, they had the most ADD, they had the most attention issues, focus issues, they had the worst emotional state, a lot of different things. Those that had the best microbiome, the best amount of probiotics, they had the best attention, the best focus, they were the most stable emotionally, just really good brain kids. And so we know that we have to start in that gut, that we have to look at what is actually causing damage in the gut and what can we do to help build it up. So a lot of times people are thrown antibiotics, staph infections, strep, earaches, all these different things. They're going to get antibiotics after antibiotics. Unfortunately, this knocks down a bunch of the good bacteria, and then the bad stuff is able to proliferate. So what do? Well, for one thing, we need to be on antibiotics as little as possible and as short as possible. New research is actually showing that instead of, remember how they used to say, you want to take the whole antibiotic package, otherwise you might create some stronger bacteria down the road. Well, what the research is showing now in the latest recommendations is it's much more damaging to that microbiome to do that. So you need to stop as soon as the symptoms start changing. So pretty profound what the research is showing, and we've got to make these changes ASAP. So that's one of the big things that we look at. And then we start talking about the overly clean environments. And this is a little bit different than a lot of you are probably thinking, but one of the problems is that when we start sterilizing everything, you've got your antibacterial wipes, you scrub down every single surface possible, you're actually not allowing your child's microbiome to grow and to experience different bacteria and different things. So we actually need to be a little bit more dirty, and especially outside dirt. Like, let them play in the dirt, let them play in the garden. If you have any space at all, let your kids help you garden. Play with worms, do all those different things. That's going to help build this microbiome as much as anything else out there. So there's things that we need to do to stop that damage and then start that repair. And so that's where we start looking at the microbiome and using probiotics. A lot of times we have to knock off bad things first, using oil of oregano, garlic. There's different herbs, different roots, different things that are going to be able to knock down that bad stuff. But oil of oregano is a great place to start. Garlic is a great place to start as well. I usually do 2 or 3 weeks of that, knock down the bad stuff, and then we come in with good probiotics, a good quality, high potency type of probiotic. So that's a big part of where we go with that microbiome. The other part that we start thinking about with gut is actually to help what we call leaky gut. Leaky gut is from things like antibiotics, but it's also from food allergies, all these different things. So if somebody has autoimmune, if they have eczema, if they have any of these inflammatory conditions, it's almost entirely going to be 100% that they're going to have leaky gut going on. So it's that small intestine lining gets damaged and we're not able to absorb nutrients like we should. It creates this inflammatory cascade, and it's going to cause a lot of other problems that we're seeing in there. So what do? Well, there's specific things that we need to go down and look at. And glutamine, marshmallow root, aloe vera, some of those are really, really helpful at calming down that inflammation in the gut. Bone broth protein, collagen, these are both very healing for that digestive tract. So if somebody has eczema, if somebody has autoimmune condition, if they're getting rashes around their mouth, if they have inflammation, if you change their diaper and they've got inflammation, any of these things are all going to be related to that leaky gut. You've got to get in and you've got to go down that path of healing up that leaky gut. So we will have some other videos on our Facebook page and on our website, and we'll get more in depth into how we go about healing that leaky gut and how you can help that body heal as much as you can. Again, hit that share and like button at any point throughout this. Let your friends know. The share button is a wonderful one because that's going to go specifically to certain people that you know need this help. And this is what we do every day, all day, is help people with these dramatic changes. But the like button is great too. That one just gets people interested in grabbing in and wanting to hear this information also. So ADD is rampant. There's kids everywhere. There's adults everywhere that are dealing with this. We need to get this information out there. So again, in my book, I talk about some other things that we look at that are going to help rebuild that brain. We talk about the different foods that are going to be helpful for that, different supplements. But one of the other big ones that we look at is keeping that blood sugar as stable as possible. Kids that their blood sugar gets too high or too low throughout the day are going to have a much harder time staying focused. The brain needs 2 things to function optimally. It needs activation, which is movement of our joints, and it needs fuel, which is oxygen and glucose. So if that glucose, blood sugar, is too high or too low, so if you're feeding them Cocoa Puffs for breakfast, any sweet cereals, donuts, Pop-Tarts, bagels, toast and honey, anything along those lines, that blood sugar is going to be shooting up. If they're going all day long without eating or just having a little bit at lunch but not very much, they're going to be crashing. Either one of those, their brain is not going to be working as well as it should. So we've got to stabilize that blood sugar, get it working as well as we possibly can. And then we get into the brain side of things. So what can we do? And this is called functional neurology. What can we do to help stimulate this brain? And again, I don't have 45 minutes a night. You don't have 45 minutes a night to do this probably either. So what can we look at? Well, a couple of the basic things. I'm going to give you guys some tricks. This is some insider tricks here that you're going to be able to check on yourself or your kids. And we see it all the time with them. The first thing that we need to look at is what are called primal reflexes. So primal reflexes, here's one that we look at. So we go like this along the palm, and it should just stay like this. If it tries to grip it all, just like a baby, you put your hand there and the baby grabs it. That one, or along the cheek here. And if there's any kind of movement, if it tickles a lot more, anything at all through that cheek, that's called a rooting reflex. Get onto the foot. I can't bring my foot up that high, but on the foot should curl down a little bit. If it does this is called Babinski Reflex. So if it does that, that is still there. So any of these reflexes, if you grip, if you do any rooting, or if you Babinski on the foot, we know that those reflexes are inhibiting the brain from being able to do as much as it can. So what do? This is the easy part, and it only takes a few minutes a day. So let's say somebody still has that rooting reflex, every time they brush their teeth, take that toothbrush or their finger and do it another 15, 20 times. Do this one 2-3 times a day, 15, 20 times, do it for 30 seconds, whatever you do. And in 2, 3, 4 weeks, those rooting reflexes are going to be gone. The brain is going to be able to heal to that next level. Another thing that we look at is the cross-crawl mechanism. So with this one, we want to do right arm and left leg, left arm and right leg. And that's just like that regular marching pattern or the skipping pattern that we do. So if this is not there, then we know that that brain is not going to be communicating side to side. So how do we test this? So go down on hands and knees, or your child go on hands and knees, raise one arm, and tell them to raise a leg. Almost every single time they will raise that same leg and they'll tip almost on there. Instead of raising that one and then raising the other leg and being able to stay steady there. So don't tell them which leg to do, but you want to check that. If they don't have it, pretty simple there as well. Work on cross crawl patterns. So again, you're going to want to tap that side and tap that side. And you go back and forth, do that a couple times a day, 30 seconds to 60 seconds. Let's just start rebuilding that brain side to side. And then we can get into which side may be more dominant, right or left side. And there's different ways that we can get into that after we heal through these different pathways. So a lot of different things that we look at when we start thinking about how can we stop the damage going into the brain? How can we start repairing what's going on as well? So then we get into the part that has truly revolutionized my son's life and all of the patients that we work on's life. So this is what's called a brain map. A brain map is a diagnostic tool. At the FDA, they approved it in 2013 diagnostically for ADD. So the company went through the process, they showed them all the research, showed them the 12,000 brains, did all these things to say, hey, this is reproducible. We know exactly if you map today, next week, the following week, it's going to look almost identical, and it's going to show us exactly what's going on in that brain. So we map the brain. It's an easy, non-invasive technique, takes about 15 minutes. We put basically a swim cap onto the scalp, and we're able to detect electrical activity. We're not putting anything in, we're not taking anything out. All we're doing is just measuring, just like an EKG of the heart. So if they put sensors on the heart, they're going to detect that electrical activity of what's going on there. So what do? Well, once we get that information, we can tell exactly, is this ADD? And if it is, great, we can train that. If it's not, that's great too, because there's a lot of patients that we've seen over the years that have been diagnosed ADD, but it's not truly ADD. And that's the important part I want you to get with the brain map, is that it's never going to be just this is a ADD protocol and this is what we do on every single patient that comes in. No, functional medicine is individualized medicine. We need to come in specifically with what that person needs. And when we do that, we start training that brain specifically. We come from a neurological perspective. Remember, most ADD symptoms are coming from a neurology part, not a biochemical. Biochemical would be if they had that problem and Ritalin or Concerta or Adderall fixed it, but that doesn't fix it. The research shows with the brain training, the program we use, they compared Ritalin and the brain training. They both decreased ADHD symptoms considerably. They stopped for 6 months. And guess what happened? That Ritalin group went right back up to where they were. The rest of them stayed the same. So the ones that had trained their brain, had trained their neurology, maintained those symptoms almost the entire time. Pretty fascinating that it was able to be a permanency to that, where the Ritalin group, right back to where they started. So all those months or years of taking it did nothing to correct the underlying problem. So what do we need to do? Well, we know we need to do that brain map, and this is the easy part, and we keep it as simple and easy to do as possible. I want to know before we start working with somebody if this brain map and this program that we're going to do is going to help them and it's going to be a good fit. Those are the two things I want to know. So it's only $90 for that brain map, and we're going to be able to review that map and do 2 trial sessions for that whole $90. Why? Because I know that if it's the right brain and if I'm going to be able to help you and the trial sessions look good, then you are a good candidate for this program, or your child is a good candidate for this program. And once we do that, then we're going to be able to change those brain patterns, and this is what we've worked with thousands of patients with, is changing those brain waves. So we're able to see all these specific patterns. The ADD one, what does that look like? Well, it's pretty simple. Easy daydreaming, hard time focusing. So we have a focus wave, and we have a wave that's most active when we're daydreaming. So what happens? Well, if we're really low in that focus wave and we're really high in that daydreaming wave, what does it sound like? Well, it sounds like we've got the Charlie Brown and the adults there. Wah, 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 wah. That's basically what it sounds like to these kids. And they can be thinking about squirrels, they can be spacing off, they can be looking over here, and it doesn't have to be a hyperactivity. Dr. Daniel Amen, he's got an amazing book out there, The 7 Types of ADD, and he found type 1 is hyperactivity, ADHD. Type 2 is inattentive. So you're not causing problem in class, but you're spacing out, thinking about whatever the whole time. So what do we need to do? Well, we need to figure out, is it ADD? If it's not ADD, which a lot of times it's not a traditional pattern, but there's other reasons. Maybe it's that worry, anxiety part of it. A lot of females we see don't have a traditional ADD pattern, but their brain is just spinning all day long, and they never take in all of the information that they need to. So these are all the amazing things we're able to find with that brain map. And then when we do the follow-up brain map, we're able to say, hey, we're going in the right direction. We still need to work on this area. It's our baseline and our reevaluating tool as well. So then we get into what can we do with the brain's neurology? Well, once we get that brain map, we know, so let's say someone's low in that focus wave and someone's high in that daydreaming wave, we know we need to train that brain to do something different. So every time that brain goes too low in that focus wave, boom, we're going to give it a feedback and a reward. So basic operant conditioning. So let's say we're on a cart and we've got a donkey in front of us and we want to turn this way. We take the carrot this way, and that donkey says, hey, I want that carrot, and it turns this way, and then we come back that way. And that's what we're doing with the brain. We're encouraging it to go one way or another. So if that focus wave goes down, what happens? Well, the screen and sound. So if we're watching a TV screen, you'll actually see the color and the sound of the audio will go down. And the brain says, oh my gosh, I'm watching whatever it is, Family Guy. If somebody wants to be watching Family Guy, they're like, oh my gosh, this is fading out. What's going on? As soon as they find that good brain pattern, boom, it's going to come back on. And then it's going to fade to that old cycle, and it's going to go away, and then it's going to find that new one, and it's going to come back on. So it does it again and again and again. And eventually, that brain is going to learn, hey, my world's brighter when my focus wave is higher and when my daydreaming wave is lower, and we start bringing it more to a balanced position. So this is the exciting part, is that we're able to catch it, we're able to figure out what's going on, where those imbalances are, and then from there we're able to say, okay, let's train this, do something different, let's create a permanency to what we're seeing, and let's also evaluate the gut, let's evaluate the blood sugar, let's look at blood work, let's look at all these other biochemical things, because a lot of times there is a biochemical component to ADD, but if you're not addressing that neurology, if you're not addressing that underlying neurological state, you're never going to get accomplished what you want to get accomplished. So we need to start at that basics. Do the brain map, $90 brain map. You can email in, you can do a Facebook private message, send over your phone number and email address. We'll get you scheduled right away for that brain map. We usually keep a couple spots every day, so we should be able to get you in within the next week. We can do that brain map, and we can say, hey, is this ADD? Is this the type of brain that is neurologically deficient that we need to help learn how to be into a different state? If it is, let's do a couple trial sessions. Let's see how the brain goes. And if it looks like it's a good fit, we're going to be able to help you. You or your child can be accepted into our program, and we can take you to that next level. We can change the brain waves to that place where they want to be in that good state. They want to be focused. They want to be on task. They want to do all those things. If this is interesting to you guys and you've been listening, go ahead and hit that like or share button again. This is when we really get into that important part of it, that we can create that permanency. We can create that long-term change that everyone knows they need. So again, we can schedule that brain map. We can do the sessions, and we can train that brain to do something different. If you have any questions at all, feel free to type them in. Feel free to send them over, and we'll answer those questions specifically. And we're going to be continuing to have more information come out, Facebook Live events, little research reviews, a bunch of different information. So keep checking back to the Facebook page and let us know if you have any questions at all. But we'd love to hear from you. We'd love to take your child from that place where if you were on the porch 30, 40 years down the road and you're sitting there in your rocking chair and you're thinking, man, I wish that we would have done something different. He hasn't kept a job. He's gotten divorced. He's 40 years old living in our basement. He's not able to stay on track. He's tried going back to school, all these things. Or you could be on that rocking chair watching him with his wife, watching him or her with her husband and their kids and having fun, and they just got a raise at work and they're in a managerial position and life is just cruising along. This is that point where we can diverge one way or the other. And I've seen it with my son. I know that he's got every potential possible now versus before he was going to be limited by what his brain was going to allow him to do. So I look forward to hearing from you guys. If you have any questions at all, let us know. And that brain map, again, $90. And we'll do the 2 trial sessions with that as well. Drop us a line. We'll get a hold of you as soon as we can. And I hope you learned something this evening, and check back to the Facebook page and we'll keep getting you more information.